Okay, so we're going to do a simple dressing using no-touch technique. The first thing I'm going to do is I'm going to set up my sterile field. So we're going to do it in stages. So before I start, once I open my field, I can't leave, so I have to make sure I have all my supplies. So I have 2x2s, I have 4x4s, these are gauzes. I have an ABD pad or an abdominal pad. I've already checked the doctor's order. So he ordered a 0.9% sodium chloride, which is also known as, you think, normal saline. The doctor might have ordered sterile water as well, so that's why we checked the order. I checked the order to see if the dressing was to be changed, how often, etc., etc. Before I start, I would assess my client's pain. You can't see him, but his head is up here. I assessed his pain. I gave him some pain medication about half hour, 40 minutes ago. I took him to the bathroom because I don't want him to have to go to the bathroom in the middle of the procedure. I positioned him comfortably, which you'll be able to see in a minute. Sometimes, depending on where the wound is, he may have to be side-lying, and sometimes you might need help just to hold positioning. So again, if it's a complex dressing and you're going to be there for a little while, the client can get fatigued very quickly. So this is just a simple dressing, so we're going to set up our field. So I have already taken my package out of the plastic bag. I don't know, I think I reminded of. Anyhow, when you open up your plastic bag, you'll see at the top is a little perforated area. You just open up that perforated area and take out your tray. You want to take it out so that first flap actually moves away from you this way. Okay? So when I open it, I don't want to lean over my tray this way because that goes against the principles of asepsis. I'm going to go off to the side. So I'm going to find that open flap. Again, my sterile field, I can touch that 1-inch border, but nothing beyond that. So I've opened up that first half. This next flap is just waiting to be opened. And as I'm opening, I'm looking for those transfer forceps. I'm like, where are they? Here they are. So I can grab those. That third flap opens to the left, and then this final flap opens towards me. And as I open it, I like to turn my tray. Okay, so right away I am going to just move my tray over to the left, and I'll show you why in a minute. The other thing I want to talk to you about is just the setup before we continue. You want to have your work triangle, so you want to go from your sterile field to your dressing, and then I'll have my garbage over here. I don't want the garbage near my client's face. I don't want my garbage over here because I don't want to come across my sterile field with contaminated garbage. So that's the rationale. So why don't we first see what's in here. We have a sterile drape. We have a garbage. We do have some gauzes in here. We have some 2x2s in here. We have these metal forceps. So it's good just to get those up and standing. One. You don't want those to fall, so be careful. They always fall. Okay, so now we're going to open up, actually let's put our garbage. So we can pick up our garbage. It is sterile. I'm using my sterile transfer forceps. I can grab my bag. It's now no longer sterile because I'm touching. And again, my tips are going beyond that contaminated 1-inch border. So I can just take my garbage over here, and you can either place it on the bed, you can tape it to the bed, whatever works for you. As long as it's not in their face. I don't really care where the garbage goes. Some people like to tape it on the bed. I'd like to mention as well that my entire table is above my waist. If I were to set up my field down here, I don't even know if you can see that, but everything would be considered contaminated. So first thing you're going to do is bring that table up above your waist. Okay? So now we're going to open up some packages. Mine have been opened already. You would never use a package that has been opened. If it's opened or ripped, or if it's wet, you're going to toss it and get a new package. So opening packages, you want to turn away from your field. You don't want to stand over your field and open them because you're going to contaminate. So just turn a little bit, rip open your package, and again, what is in here is considered sterile. I can touch the bottoms. I don't want to touch. And I'm going to use my forceps here to get that out and lay them down. Garbage. Open up some little 2x2. So again, I'm turning, I'm opening, You might see some nurses flipping onto their field, so they'll actually flip them on. It's really poor practice. Best practice stage, you should use your forceps to remove. It's very easy to contaminate when you're flipping onto your field. That's it. And then finally my abdominal pad. So again, I'm just turning away, opening up that big pad using my forceps. Drop that off, and garbage. Okay, so I'm doing good. I have what I need so far. So the next thing I'm going to do is I'm going to do my solution. So the doctor ordered normal saline. If this is a brand new bottle, I'm going to crack it open, and you'll actually hear it go, crack. If it's already been opened, it should be signed and dated and timed. If you find a solution that's not dated or signed, you're going to treat it as being contaminated. Okay. So if I crack this open when I'm all done, I'm going to write DS February 25th at actually 6 o'clock. So that's what I would write there. Okay, so what we need to do now, again, cap goes up, we want to maintain sterility, is I'm going to cover the label. I'm going to pour off a little bit into my garbage. It's called lipping. I don't know if you can see me or not, but I'm just pouring enough to cleanse the lip of the container. And then I'm going to turn it this way because I lipped the bottom. You don't want to use a lot of it for practice because you're going to soak everything, so just go through the process. So now I have to pour in some solution, and that's why I moved my tray over to the left a little bit. You don't want to pour too high, because if you splatter, everything's considered contaminated. You don't want to go too low, because you're going to contaminate. I'm just going to come over here, and you're just going to pour enough to do the dressing. I probably need a little bit more than that. Okay, so the next thing I need to do is I need to remove this dressing. So I'm not going to remove it just yet because that's going to be the next step, but what I am going to do is I'm just going to loosen the tape. Now I don't know if you can see this or not, so I'm going to wait for the next step. Loosen the tape. And then the last thing I'm going to do is I'm going to drape my patient. And you'll notice on your field there's just an extra little drape, and all you want to do is pick it up and just find that 1-inch corner. I don't want to see any flapping. I'll show you once. Please don't do that. It's very bad. You just want to pick it up and you're going to bring it over and you're just going to drop it. It just extends your field there. So I'm going to see if you can see that draping there. I don't know if you got to see it or not. So again, I unfolded it, I can't speak, and I just dropped it off. And that is setting up our field. So our next step is going to do our simple dressing, and we'll do that in just a few minutes. So stay tuned.